Hi, everyone. Thanks for joining us again for another interview with Miles for Hips. This is for international hip dysplasia around the world. And I have Dr. Carlos Vidal with us. Dr. Vidal, would you like to introduce yourself and say a few things about your background a little bit?
Ashley, thank you very much for this interview. Thank you very much for having me in your in this Zoom meeting talking about hip dysplasia, because this is a very big problem worldwide and we need to solve it. We need to resolve this. My name is Carlos Vidal. I'm from Mexico City. I'm a pediatric orthopedic surgeon. I was trained in orthopedics in the National Institute of Rehabilitation and Orthopedics in Mexico City. And I was also trained in pediatric orthopedics at the Schreiner Hospital for Children in Mexico. I have I have taken courses in screening test with the Graph method. With Graph, he was my mentor in this field, and I took them in Wales, in the UK. So I love to do the screening test. I'm passionate about hip dysplasia, and it's one of my most important fields in my medical consults in every day in my office.
Amazing. How did you become interested in hip dysplasia specifically?
Okay, well, I have a great mentor, and now it's a very great friend of me, Dr. Pablo Castañeda, which is now the chief staff in Texas Children in
Yes.
this surgery field. He was my mentor here in Mexico City at the Schreiner Hospital for Children. I got all my training with him, and then we created a society. We were partners as orthopedic partners here in Mexico. We opened our medical office as a partnership. And then he moved to the US, but I learned a lot of hip dysplasia uh, of him. He was a great mentor. All I know about hip dysplasia is because of him. And he put me, he put this seed in my soul of doing um, everything I could in hip dysplasia. So I'm very grateful with him, and that's the way I get into this world of hip dysplasia.
Very fascinating. I love Dr. Pablo Castaneda. He's very, very nice.
Yeah, he's a very good guy, and in the orthopedic field, he's very important. He's a very important.
Absolutely. Absolutely. Can you share information about how patients are screened or come to be diagnosed with hip dysplasia in Mexico?
Okay, in Mexico, since many years ago, it's mandatory that all the kids have ortolani and Barlow maneuvers. They have to be done with expert hands, pediatricians, orthopedic hands. But before 2016, there was only this mandatory physical examination. After 2016, it began to become in the law that we need to give not only physical examination to the kids, we need to give also a diagnosis made by x-ray films, or if possible to have an ultrasound screening test, it will be better. So by now it's mandatory that all the Mexican babies that are born in Mexican territory have an examination by their pediatricians with ortolania and Barlow maneuvers, and an image done with x-rays or ultrasound screening test before the age of 4. That's why our law has a statement. So I don't know if all the babies have all these images, but at least it's by law.
That's amazing. Ultrasound screenings would be so critical and useful, especially in the US as well. I think that would be an amazing thing to have done here as well. Once a patient is diagnosed with hip dysplasia, what would a typical care pathway look like in Mexico for the patient?
Okay, if the patient has been diagnosed with hip dysplasia by their pediatricians, normally the pediatricians send the babies to the orthopedic departments. Uh, if the baby was diagnosed by the orthopedic surgeon, well, the treatment it's immediately given to the baby. So if the baby has less than 6 months old, public harness it's the best method. It's the gold standard for treating this problem. The thing is that there are some regions in Mexico that are very far from big cities, and we still have the problem, as in many parts of the world, that we are catching the problem when the kids are 2 or 3 years old, when they are getting a bad pattern in the gait, that they are like twisting the hip, and suddenly it appears in an X-ray. So if the patient is diagnosed after the age of 6 months, public hardness is not going to resolve the problem. So probably we will need a surgery, at least a close reduction and a spica cast, or maybe an open reduction and a pelvic osteotomy to resolve the problem. So it depends on the age that the patient comes to the office. But as soon as the earlier they get into treatment, better. So if these kids get into treatment before the age of 6 months, public harness normally resolve the problem.
That's amazing. That would be fantastic. I know for so many of the patients we see in our groups and the patients that come to us, um, they're older, either adolescents or adults, and that's not the case, where the ortolani test did not detect it as a child, and so they were late diagnoses, and and so either arthritis is set in at some point or a little bit, or there's been some damage, cartilage damage. And so that would be amazing to see more babies being treated at an earlier age. What priorities or opportunities are there for hip dysplasia related care, research, or education in Mexico? And are you involved in or aware of any activities in your region to address these?
Yes, well, since 2011, Dr. Pablo Castañeda and I began to give medical courses about ultrasound screening test with more or less with the version of screening test that it's given in the US. But then in 2018, I wrote to Dr. Graf. I googled it. I googled him, and I knew that he was alive and he was giving medical courses in screening test with ultrasound. And I took a plane and I arrived into Wales, and I took the basic course in screening test with him, which is completely on the opposite side of what we learned as a US method. And I realized that I need to give this information to the Mexican medical field. And with some other partners, I create the Mexican Association in Hip Ultrasounds and Hip Dysplasia. And now we are running some medical courses every year, a basic and an advanced course in the graph method to create this conscious in all the medical field, and not only in them, also in the parents, that hip dysplasia is so common, but we can make an early diagnosis if we know the method. That now we are giving these courses in Mexico every year, and not only in Mexico, we have been in Colombia, in Ecuador, and in Guatemala, and we are expanding the knowledge of hip dysplasia and trying to uh, to make a sensibilization in all the people all around the world that this problem, it's a health problem, it's a worldwide health problem, and it's so common that 1 per 50 babies will have hip dysplasia. So now we are doing all we can do. We're putting all our effort in expanding what Dr. Graf described 4 years ago. The way he did it, it's the way we are doing now.
Now, can you show us the model that you use to teach or learn on with the Dr. Graph model?
Yes, of course. One of the very big problems in teaching a method is that normally we teach with real people. So trying to teach an ultrasound screening test for a baby with a real baby, it's a very big problem because normally all the babies are crying, the parents are like,
Anxious.
yes. So um, there's one plastic model, which is this one, which is called a phantom baby, which is a hard plastic model, but it has latex and soft materials here at the hips. This baby, this phantom baby, has two normal hips in each side, and we can be trained in the ultrasound method with this model. This model can teach you how to do the screening test. You can perform and you can improve your skills without real babies. You can improve it with these kind of models, and then you can uh, begin practicing in your medical office with real babies. No, you can improve your skills with medical babies, trying to give them the best you can. So this is a good piece of plastic to teach medical doctors.
That is amazing. That is a great piece of information. That's really cool.
Yeah, this was created by Dr. Graf and a biotech facility in Japan, which is called Kyoto, and they have this baby for training process. So I think it's a very good way in a teaching method.
Yeah, they have it for every other specialty. Why not hips?
Exactly. You have for basic life support, for advanced cardiac life support. So all the medical fields are training with plastic models. So why not in the orthopedic field? So
Exactly.
this is a good way to get knowledge in this problem.
What is your vision for the future of hip dysplasia?
Okay, my vision. I share my vision with Pablo. I share my vision with Dr. Graf, and Dr. Graf had this same vision 4 years ago. He said, "Okay, well, if we create a system for our country that all the babies can have this ultrasound screening test, then the late dysplasia problems, the sequela of the hip dysplasia, will disappear probably in 30, 35 years from now." And he did it. Now, in Germany and in Austria, they don't have late dysplasia problems. They resolve the problems in the early stage using only public harness. But how they get into this by doing ultrasound screening tests in all the babies. So in Germany, in Austria, and in Mongolia, it's completely mandatory to do this screening test. If you, as a parent, don't take care of your baby hips, you're doing child abuse. In the rest of the world, is
Wow.
well, okay. You want to do an ultrasound screening test, it's okay. You want to do an X-ray, it's okay, but in those countries it's mandatory. And 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 the real thing is that it's mandatory, and now 40 years after it was implemented, they don't have late dysplasia. So it's working. Yes, it's working. So trying to resolve your question, what's in the next years, if we establish this screening test as mandatory test, probably in 40 years from now, we are not going to see early arthrosis by late dysplasia problems. We're not going to put hip replacement by late dysplasia problems. So we're going to resolve a healthcare problem all around the world, but we need to be in the same channel. We need to be in this same pathway of trying to make a screening test in all the babies, not only the ones that have risk factors. Now has
Yes.
now we have a lot of information that tell us that risk factors are not, well, are not nothing more than something that was related to hip dysplasia, but this is not guarantees. If you are
Right.
female, breech presentation, first baby, and family history, it seems that you're going to have hip dysplasia, but probably you're not going to have it. It's only risk factors. But on the other side, if you are a male, you were delivered not by breech presentation, you are the second or third birth in your family, and you have no family history. If we keep doing risk factors as a as a related point of having or not having hip dysplasia, we're going to fail. We're not going to catch the hips that have dysplasia. We need to think that all the population have hip dysplasia. We need to go to detect all hip dysplasia, and that's the only way that we will decrease the problem of late hip dysplasia. So we need to think that everybody has it. So we need to screen everybody and to catch all these hip dysplasias in an early stage. That's the way, that's the pathway. That's
Oh, absolutely. Like I was a second born middle child, not breech. Like, so I didn't hit any of those factors. And I'm the only one in my family that has hip dysplasia. So
exactly. So if we think that we need to catch risk factors, you only have one. Okay.
I'm just
So
female. So that's it.
that's your only risk
X
factor.
factor.
And you got hip dysplasia. But I know a lot of people that are males, third third son, no family history, and they have hip dysplasia.
Dysplasia. Yeah.
So
We're seeing that more
there's
in our group. Yeah.
there's a rate of only 12 to 30% of patients that have hip dysplasia that also have more than two
Risk
risk
factors.
factors. So talking about risk factors is old school. We need to avoid them. We need to think that all the people has hip dysplasia, so
Till
we
proven
go
otherwise.
to catch it. Otherwise, we're gonna miss it.
I think that's a great idea. I love that. Well, thank you so much for your time and sharing the model with us and your information, Dr. Vidal. It was great having you on, and we would love to hear from you more in the future.
Of course.
Um, Thank you for your time, and thank you everyone for watching. Um, we shall see you again soon.
Thank you very much for the invitation, Ashley. And I think that you're doing very great things with your association. So don't stop doing that. It's your mission in life to create conscious and to expand the knowledge about the problems that you have, the problems of hip dysplasia and the sequelas of a late hip dysplasia. So congrats about your podcast and your Zoom meetings. Keep doing it.
Thank you so much, Doctor.
It's a pleasure. Thanks for the invitation.